Yes, today, according to the topic, we are talking about thrombosis. What do we mean about thrombosis? As per the title, as you see, thrombosis is the formation of minute. Thrombosis means a formation of blood clot inside a blood vessels. When the blood clots inside a blood vessels and forms a clog, it's called thrombosis. It may be in any blood vessels, the heart blood vessels, the leg blood vessels. We have several blood vessels, but today we want to know just highlights about thrombosis and how it happens. Now, we classify thrombosis as per the site of occurrence, and there is another one we classify by clinical behavior, and then we classify them by relation to the vessel wall. Those are the three main types of thrombi or thrombosis and how we classify them. Remember, we have said thrombosis is formation of formation of a clog inside a blood vessels. A blood vessel. Now we will continue, and we have classified them in three main. It will be a faster topic today, introducing blood clots and thrombi, how they are clogged inside the blood vessel and how they are. Now, we continue on the three types of thrombi. We classified them three types. No, now the first one, about by the site of occurrence, occurs in the arteries, high flow vessels, where the blood is flowing so fast. That is called a arterial thrombosis. Thrombosis. Common sites are coronary at the heart. You get it? Coronary at the heart, cerebral at the brain, and femoral artery at the femur. Femur is on your thigh leg, usually due to atherosclerosis. Atherosclerosis, you will see, is when we talk about atherosclerosis. Atherosclerosis is a chronic inflammatory disease of an artery. When your artery is undergoing inflammation, and then it narrows the lumen, the size where blood flows narrows, characterized by buildup in rich plaque in arterial, leading to narrowing, hardening, and reduced blood flow. You know, when the lumen where blood flows narrows, the blood flow reduces. So it gives a chance of more plaques, more cholesterol, more blood clots to sediment. And then we have platelet-rich white thrombi. You know the work of platelet is to coagulate so that you don't bleed. Normal thinking. Home build services is here. Yes, welcome home build services. A quick topic on platelet and on thrombi in the inside the blood vessels. We are on the platelets. Platelets are when you have rich platelets, you may be in turn having more problems when it comes to clotting. So you may have a clot inside your blood vessels. Yes, so this is by the site of occurrence where clot may occur in the arteries. And you have said the common sites, and you said usually two examples of the site where coronary thrombosis in myocardial infarction. When you have a problem in the heart and then you're told you have myocardial infarction, the heart may not be getting enough oxygen due to the clot or thrombi, which is not making blood to pass through the heart vessels. You get it? So it lacks oxygen, ischemia, leading to infarction. And then we have cerebral thrombosis. When you talk about cerebral, we are talking about the brain. You get ischemic stroke. Ischemia is lack of oxygen. So when you have a thrombi to the blood vessels that are going to your brain, we say that is cerebral thrombosis. So you get ischemic stroke. When you lose oxygen in your brain, you can get a stroke due to lack of oxygen. So we call it ischemic stroke. And then we have peripheral arterial thrombosis, acute acute limb ischemia, acute limb ischemia. When you have a clot at your femur, at the thigh, it may make blood not to flow to the extremities, or at the fibula, here at the area of the iliac fibula. It may make blood not get to your toes. So when your blood is not getting to your toes, what happens? Your cells and your toes start dying out because of lack of oxygen. So you get acute limb ischemia. Lack of oxygen is called ischemia. So those are the three examples that you may get by categorization of site of occurrence. We have the next one, which is venous thrombosis. Venous thrombosis, yes, that is B. Venous thrombosis occurs in the vein, low flow levels, rich in fibrin and red blood cells, often related to stasis of or hypercoagulability. So stasis means flow. So when you have low flowing blood in your body, it may lead to a thrombus. You get it? Or hypercoagulability. Your blood coagulates faster. You have no enough coagulation factor. Anticoagulation factor means you have low factors that makes you not to your blood to coagulate. Yes. Thanks, bro. Yes, thanks, bro. Those factors make you not to your blood to continue not to be to continue flowing well. So it becomes thick or coagulates. Those are the venous thrombosis factors. You get it. And then we have deep vein thrombosis. Here is in venous thrombosis, and then superficial thrombophlebitis. Yes, and pelvic vein thrombosis. Pelvic, you know where the pelvic is. Superficial thrombosis, you know where it. Deep vein thrombosis, you know where the deep vein thrombosis gets at the dorsalis pedis, at the foot. There is a vein uh, that divides there, and it's called the dorsalis pedis. Pedis because of it's above the calcaneus. Yeah. So that is, it may cause venous thrombosis. Yes. And then we have C, cardiac thrombosis forms within the heart muscles. Cardiac thrombosis forms within the heart chambers. Examples: left atrial thrombus, arterial fibrillation. Fibrillation. You know, when you lack, you are not getting enough oxygen to your heart. What may happen, my friend? You may get fibrillations. Fibrillations means your heart may not pump normal. It may pump slow or fast to compensate. You get it? Ventricular thrombus, postmyocardial infarction. Yes, you get it? Postmyocardial infarction. And then we have mural thrombus. Those are the three that occurs in your heart. Cardiac thrombosis. One is left arterial thrombus, ventricular thrombus, and mural thrombus. Now, the second one where we say by clinical behavior, occlusion thrombosis, non-occlusion thrombosis. Those are the two. Complete block of the vessels. You have a thrombi inside your vessel that has completely blocked. This one is an emergency. You need to visit the doctor office so that they can unclog it, because if they don't do that, your limb, your hand, where it may cause more problems. You may get ischemic. You may lack oxygen and the limb may become gangrenous. Gangrenous means it may die off due to lack of oxygen. Yes, because gangrene is a dead thing. And then causes of acute ischemic infarction. Acute ischemic infarction is very complicated. You get it? You need to see. It may cause transient ischemic attack. You get mild stroke. You admitted, and then we deal with it. And then we have Non-occlusive thrombi, partial block of vessel may progress to embolize. Those are the two types when it comes to clinical behavior, by clinical behavior, and then we have by relation to the blood vessel wall. We categorize them by relation to the blood vessel wall. One, A, we have mural thrombosis attached to the vessel of the heart wall. Does not fully obstruct the lumen. It is just attached to the blood vessel of the heart wall, but does not fully obstruct the lumen. Some blood is passing through and going to the coronary, around the coronary veins. But B, we have obliterary thrombosis, completely fills the blood lumen. Blood cannot pass. You see, that seems like an emergency. And then we have the fourth one, which is by cause pathogenesis due to vicious triad, endothelial injury, abnormal blood flow, hypocoagulability. That is something we say vicious triad, endothelial injury. Your blood vessels are injured, and then the clotting, there's a clot inside, or it does not pass blood where it's supposed to be. That when we say it is endothelial injury, and this is often to the students of medicine or yes, sciences, where it comes to health sciences, you know what vicious triad is. Abnormal blood flow, slow flowing blood flow because of high cholesterol levels. You see, that one is the second one. Or hypercoagulability. Hypercoagulability, you have high amount of platelet reaction, or antihemophilia is low. See, those are the three, the vicious triad by cause, pathogenesis, and then embolic thrombosis. Clots form everywhere and lodges in the vessel. Get it? So those are the a quick, we are going through a quick summary of what is a thrombi. Thrombi means formation of blood clot inside the blood vessels and or heart. It may be a blood vessel everywhere. So here we have the categorization. We have said by site of occurrence. One is arterial thrombosis, two is venous thrombosis, C is cardiac thrombosis, and the other one we have characterized by clinical behavior, occlusive thrombosis and non-occlusive thrombosis, and then the third one by relation to the vessel wall. It may be fully or partial, where we call it mural thrombosis or obliterate thrombosis. You see, A and B and 3 by relationship to the blood vessels. But we have the fourth one, as we finish, where it is caused by pathogenesis, thrombotic thrombosis, where we get the vicious triad. I really know the vicious triad, the students of health sciences, they know about this. And then we have embolic thrombosis, is less about that. We have several ones, special names when it comes to thrombi and clots. Deep vein thrombosis, cerebral venous sinus thrombosis, portal vein thrombosis, renal vein thrombosis, DIC, disseminated intravascular coagulation. You see, this is an emergency and life-threatening condition when it comes to human life. DIC, I think I will talk about it separately and on its own. It's an emergency when it comes to medicine. Thrombotic microangiopathy. We'll talk about it again. Thank you a lot for coming to this as we speak about atherosclerosis. And I've said atherosclerosis and thrombosis are sister and brother. So atherosclerosis, I've said, is a chronic inflammation of disease of the arteries caused by buildup of lipid-rich protein plaque in arterial wall, leading to narrowing, hardening, and reduced blood flow. So you ask yourself, is atherosclerosis same as arteriosclerosis? We will answer that the next time we meet. Have a lovely day, everyone. If you have a question, be always ready to ask and answer. Have a good day.